There you go.
Recording in progress.
Okay. I think I clicked on your link to get in rather than my own link. I didn't realize it would make a difference. So,
Oh.
and it's recording already, right?
Hmm.
Okay. Good. So we can start. Sorry for the delay. So first off, I was talking to Madeline. No one wants to be here, me included, and I'm sorry you guys had to be. Um, my expectation is if you guys study and are attentive, you should be able to pass the exam. So part of it is just the way the exam was written, and I need to check that as well. I know the retake is both shorter and a little easier, so I think that's going to bode well for at least getting through that. Having said that, go. Sorry, my dog's smelling. Having said that, I don't think there was anything on the exam that you shouldn't know. Like I think the you know the exam you just took had a lot of good information on it. So I don't know how to really feel about either of those. What can I get some feedback on what you all thought of the exam?
Thought it was really tough.
It
Yeah,
was it was tough for sure.
yeah.
Um,
The,
I thought
the
the
Ross,
I
go ahead.
struggled with the back muscles, like the what is it called? The contralateral, like turning and stuff. That whole box, I was so super confused on, and that's just me not studying, I guess, them. But also, I didn't know how like in depth we were supposed to study for the back muscles. So that might have just been like my understanding
Yeah,
or like getting. But that was really hard for me. And the
Daisy,
game
what do you
was
think?
hard.
I felt like the questions were worded a little confusing. I don't
Yeah,
know. It was
yeah.
probably just me.
I think so too. It'll have to get revamped, I think. Um, Okay, so the plan today is I wanted to go over the last exam. Like I said, I still think it's all stuff you need to know. Like it's good, valuable information. Well, I'm going to share a screen. Madeline said I could use her exam to go through. And then I'm going to not share screen and pull up the retake exam and give you guys some pointers. Because ultimately there isn't a bad kid in the class. You should all be passing, and I want to make sure you guys have that opportunity. I think the hard fail for not getting 75%, I'm not a big fan of. I mean, I know they have to have a cutoff somewhere, but so that's the plan today. Any questions before we start?
I do have a couple,
Yeah,
but it's just like for me.
yeah,
Um, so the highest we can get on it is a 75, like we can't get higher than that. Okay.
right. So no matter what grade you get, you have to pass with at least a 75, but then your recorded grade will be 75%.
Okay. And then do we have all day Friday to take it from 12:01 to 11:59? Or are you opening it up like a certain period?
It's currently open all day Friday.
Okay.
And if that doesn't work,
Well, that's
I
good. I
think
was just making sure.
that's good. Okay. I
Yeah.
think it actually has to be done by Friday night because
Yeah.
school closes like officially.
And then are you grading it that night too, or will we know if we pass like Saturday?
You will know Saturday.
Okay.
I will be at a concert Friday at 5 p.m., so I won't be able to grade it that night.
Okay. That's what
Um,
I had questions on then, just to make sure.
yeah, I'm
Okay.
sorry. There's no way I could get it done.
No, that's fine.
I could check raw scores.
Yeah,
Like I said, I think you're gonna do well.
yeah.
So as soon as I can tell you, I will.
Okay.
Okay. Any other questions before we start? Okay, let me share screen. Wow, I got a lot of exams, a lot of pages up. I think I want that page. No, I don't want that page. Maybe it's this page. Oh, it is this page. We'll get there. My top bar is hidden by Zoom, so I'm trying to get back to where I was. No, my sidebar is same. Okay. Yeah, Madeline, you're so close. So we'll go question by question. As I said, this is Madeline, so her results will show. Um, I think I talked a little bit in my announcement about the grading, but there were 4 questions that were left ungraded for 0 points, and which was basically those are the ones we removed last year, and I just forgot to reset the point value. So if you got those ones correct, you got a bonus point. So you could get up to 4 bonus points. And then there were 3 questions that we threw out this year. No, sorry, everyone got the 4 bonus points. And then there were 3 questions we threw out this year. And if you got those ones right, you got a bonus point. So everyone got an extra 4 points and then up to 3 more. So this question is about having knock knees or genus valgus. I added a picture in case you didn't know what that meant. And really, a lot of these we want you to figure out, like it's a 2-step process. Like you have to realize that, okay, this hip is adducted. So what could cause the hip to be adducted? Adducted, and weakness in the glutes, which are the abductors, could cause your leg to turn in. A flat arch in your foot would cause your tibias to tilt inward. So both of those are correct. Weakness in the hip adductors, that would be weakness pulling your knees together. So that is exactly opposite. And then high arches is exactly opposite. And most of them are that way, that the wrong answers are exactly opposite. Like there's no question that they're wrong. What is the name of the highlighted muscles? Oh, and I will tell you, these are going to be in different orders because every test is in a different order, which makes it hard to sort of follow your exam. It also makes it hard for us to find the questions. There were a bunch of these. We tried to make the muscle questions easier than just saying, name the origin insertion of a muscle, or, what muscle does this, or, but I felt like the pictures were making it a step easier. So this muscle, it starts on the outside of the hip. It looks like it's the ASIS because it is. It goes down to the medial knee. The only muscle that does that is sartorius. In the thigh, there aren't many muscles, especially muscles that we ask you to know. There's the quads on the front where there's the 4 of them. There's the hamstrings on the back where there's 3 of them. There's sartorius here. There's TFL that goes into the iliotibial band. And then there's some adductors up in here that, again, we didn't expect you to know the adductors. So sartorius we've talked about in class. We expected you to know it. All the following muscles have a common origin on the ischial tuberosity. Ischial tuberosity is our sit bone. So first you had to know where the bone was. The only thing that attaches to the ischial tuberosity are your hamstrings. So it should be hamstrings. These are all hamstrings, so that didn't help you. But the short head of biceps femoris, the reason it's short is because it doesn't go up that high. It starts on the linea aspera of the femur, so right on the back of the femur. Which meniscus of the knee is more commonly injured due to its increased surface area and weight bearing, which is the medial one. We've talked about the medial meniscus and the medial femoral condyle being larger. This is also just common knowledge. Medial meniscus always hurt first, which we didn't teach you, but we did teach you that the medial femoral condyle is larger. Movement of the sacroiliac joint is called nutation and conutation. That's straight from the slides. I see Maddie got this right. Well done. Pelvic tilt, so anterior and posterior pelvic tilt are almost the same thing, but they involve everything. Um, the SIJs, the lumbar spine, and the whole pelvis moving. So it's not correct to say it's pelvic tilt, but it's nutation and counter-nutation. I think I did change this question because it did have pelvic tilt in there, which is partially correct, but not the actual movement. Inversion and eversion are complex movements involving the many joints of the foot and ankle. This makes them different from supination and pronation, which only occur in the hind foot. So there is a slide in your module. We did cover this in lab as well. The simple movement of just the heel, the calcaneus, is inversion and eversion. And then the supination and pronation of the foot is the entire foot. It's the ankle joint, the subtalar joint, and the metatarsals all moving. So that was just whether or not you understood the difference between the two. In this case, Maddie did not. You can see if you check over here while I'm talking, if it says it's worth 0 points, that question was thrown out. So that's why they would have 0 points. They either didn't test well, or there was something other problem with the joint that Jeff, sorry, some problem with the question that Jeff determined. Feel free to yell at me if you have questions or if I'm going too fast or too slow. What are the origin and insertion of piriformis? So this, again, I tried to make it a little bit easier by only giving a few answers. There were more than just 2 answers. There was, I think, 4 you had to choose from. Let's see. So what do we go? The insertion of piriformis is into the greater trochanter. So that was the thing you needed to know. You got a little back to front. You did that as the origin. Actually, you just got it exactly back to front. So it comes from the sacrum and goes to the hip. So in normal cases, it's moving the hip, moving the leg. Yeah, so generally speaking, an origin is going to be more proximal or more towards the body, and the insertion will be the distal point. So that may be what happened with Maddie on that one. This question was really just about an isometric contraction. The hard part with this question was me determining, like making you realize the knee is not moving, only the hip is moving. So that's what you had to get. So lying on your back, your client is moving the right leg towards the ceiling, keeping the right knee straight. So that's really the kicker. If the right knee stays straight, then the quadriceps muscle has to be holding it straight. So it'd be isometric. And Maddie got that right. Obviously, concentric is the muscle shortening as it contracts. Isotonic is both concentric and eccentric. They're both considered isotonic, just meaning that the tone in the muscle stays the same. And then isokinetic, if you remember, is the speed of movement stays the same. And the only time we see isokinetic movement is when there's a hydraulic involved. So if you're pushing on a hydraulic system, which is very rare, but if there was a question on an exam, isokinetic would have to have hydraulics involved. There is not a question on your final on isokinetic, so don't worry about it for this exam. The rocker question, it looks like Maddie got this one right. And really what we were looking for is, do you know what movement is needed at what point in time? So a 4-foot rocker, you're going to be standing on your forefoot or the front of your foot during pre-swing. So that's when it's important to have the rocker on the front of the foot. A heel rocker, when are you standing on your heel during gait? It's during initial contact and when you're loading. So that's when the heel rocker becomes important. And then the ankle rocker, when you're standing flat on your ankle, and that's mid stance. So that one was pretty straightforward. Maddie got it right. Some of these questions were a little hard because the pelvic tilt questions, this could be considered neutral. It could also be considered an anterior pelvic tilt because his butt's sticking out. He's got quite a big lordosis. And that's what you picked, anterior pelvic tilt. So that's good. It certainly was not posterior tilt. What's the range of motion norm for the knee during the loading responsive gait? And this you just had to know. We expect you to know for every phase of gait, you should know the joint range of motions and the muscle activity for that phase. So that probably will be on the final. And you should just have a cheat sheet, and it should have phase of gait, hip, knee, ankle, muscle, and just try to fill all those out. So during loading response, when your heel has hit the ground and you're loading onto your toes, the knee is at 15 degrees of flexion. So the other way to think of it is our heel hits and then we actually shock absorb. Our leg actually acts as a shock absorber, so it has to bend a little bit. If your knee was stuck at 0 degrees, you would hit the ground and you would have no shock absorption. It would hurt. Most of the knee flexion that occurs early in pre-swing is what and requires what, which means an appropriate stride length and stance progression on the other side. So this definition comes straight out of the module and straight out of your books. So it should have rung a bell. The main thing is that the knee flexion that occurs early in pre-swing is passive and it's caused by momentum. We did cover it in lab as well. But your hamstrings really only fire at the end of swing to slow down the swing of the lower leg. They don't actually lift the foot off the ground in the back of the gait cycle. So it's not active, it's passive. With running, that changes. With running, you might have more muscle activity at the back of the gait cycle. The plane of the ankle is oblique. And again, we covered this in lab. It's also in your module. But the ankle doesn't do straight flexion extension because your lateral malleolus, if this is lateral, sits a little down and a little back from your medial malleolus. So it turns the ankle joint to an oblique angle. And the movement that happens is abduction. The foot moves away. Ankles don't rotate, so it couldn't have been any of the rotations. Okay, 14. If a person has nerve injury that prohibits the quads from being able to contract, which of the two muscles could work together to extend the knee during closed chain? So this one you had to figure out. One, you had to figure out what does the knee do during closed chain? It extends. What happens at the hip and the knee? So if you're squatted and you're coming up from a squat, your hip is extending and your ankle is plantar flexing. So you needed to find two muscles, one that extends the hip and one that plantar flexes the ankle. And that's gluteus maximus and soleus. And then you had to know, what muscles do those things. So Maddie got that one right. That was a super hard question. Really proud of you for getting that one. There are three muscles involved in the force couple to tilt the pelvis anteriorly. So force couples, and the ones you will need to know for the retake, is the force couples for pelvic tilt and the force couples for scapular upward rotation. And there are great pictures in the I might move this. I don't think I can move it. Oh, I can. Do I want to spend the time to find them? Yeah, I think it's going to be there. Please be there. Okay, yeah, so these. Oh, these actually don't have the muscles on them. They're later. Shoot. It's hard when you can't find your own stuff. Pelvic muscle control. Okay. So this shows the muscles and what they do. So if we want posterior tilt, and what was the question? Tilt the pelvis posteriorly. You should be able to envision this, the muscles that pull. So if we're tilting it, can you see my new slide first off with
Yeah.
the okay. So if we want that rotation to be posterior tilt, if the abs pull up from the bottom, the rectus pull up, that's going to tilt it. If the hamstrings or glutes pull down on the back, that's also going to do that posterior tilt. So those are the muscles that's going to spin it that way. And then conversely for anterior tilt, what muscles are going to do that? Your erector spinae can pull up on the back, or your quads, really just the one quad that crosses the hip, which is rectus femoris, can pull down on the front to create that spin, that pelvic tilt. So that's an important slide to know. And then the scapular one is important to know. These Sarman movement system impairments, we did cover them in lab. They are in your module, and you really just need to know what they are. Maddie got them right. Generally speaking, if you have flexion syndrome, you flex too much and flexion hurts. If you have rotation syndrome, you rotate too much and rotation hurts. And if you have extension syndrome, you extend too much and extension hurts. And that's really what you need to know. Maddie got that one right. But those I think are also on the final. More about, oh no, maybe it was this exam. Don't quote me on that because I think there's another question on the Sarman ones in this one. So this chica with horrible posture, if we put a plumb line, where do you think the landmarks of the body would appear in relation to the plumb line? So remember from our labs, the plumb line starts at the bottom. It starts in front of the malleolus. So you literally could put a ruler on this and just try to see where it would fall. But it certainly looks like she has a head forward posture. So her ear should be in front of the plumb line. Her hips are thrust forward. So maybe her greater trochanter would be anterior to the plumb line. It should be through the middle, but because her hips are forward, I think she's anterior. And then her acromion, she's throwing her shoulders back. So it could be posterior. So those are what I would guess. So just look, first of all, with plumb lines, and there will be a plumb line question on the final. You have to know where they normally fall. And normally it's in front of the ankle, at the knee, at the greater trochanter, at the acromion, and at the ear. Hold on one sec. Hi. Thank you. Thanks. It's for Brooke's back. You gonna take it to her? Sorry, someone's knocking my door. No one get it. So you have to know the normals and then just take a look at the posture and say, okay, is, what looks forward and what looks back? And that would be how you would answer that. Which muscles originate in the upper posterior tibia and fibula and associated with connective tissue insertion to the navicular bone and other foot bones, performs inversion and assists with plantar flexion. So this is a harder question because there's no picture, but I gave you so much information. What does inversion of the ankle? There's only one muscle that does that, which is tibialis posterior. Um, it's the it's from the upper posterior tibia, so that's a good thing that it could be um, tibialis posterior. And then I gave the insertion. Maddie got that one right. That's about as hard as I'm going to get with a origin insertion question with you guys. Um, and that is a smaller muscle, it's not a gastroc or a soleus, but I do expect you to know tibialis posterior, tibialis anterior, and the fibula. What do you guys call them? Fibularis? I call them the perineals, but the
There's a fibularis
fibularis.
longus.
Yeah,
I-
there's longus, brevis, and tertius. There's three of
Yeah.
them.
You want us to know those for the exam? Or just in general?
Um, I expect you to know like where they are
Okay.
and what they do. They all have, I didn't even realize they all have different insertions. But just that they're on the fibula, which is where their name comes from, and that
Hmm.
they do eversion of the ankle.
Okay.
This question was hard because you had to mark more than one correct answer. What's true of the pelvises? The females do have a wider pelvis. Um, the sacrum is longer and more curved. I always think, what would help a baby get through, and that would actually make it harder because a curved sacrum would get in the way. Um, if the acetabular were closer together, that would be more narrow. So that's incorrect. And it is a more oval shape. Yeah, so it is more oval because it's wider for the baby to fit through. That's a hard question, though. I'll own that. This question is about the arch of the foot. Everyone knows the longitudinal arch. That's what people call the arch of the foot. Um, it's very important also to know what the transverse arch is, and that's what this is. You got that right. You could just know it if you just know your planes because it's transverse. Um, but you should know the three arches of the foot. So the medial one, the medial longitudinal is the one people think of when they think of the arch of the foot. There is a lateral arch that's from your textbook in your module, but the transverse arch is super important, especially when we're looking at foot pain and orthotics. So it's important to know that. Which phase of the gait cycles has the most muscle contraction, both more muscles and higher activation? And this you should know. It's when your foot's hitting the ground and you're absorbing that shock. So it's weight acceptance. Single limb support, that's a decent answer because you think all your weight's on one limb, so it's going to be harder
Yeah,
work.
that's what
But
I
it's
thought. But
yeah, but it's not because your weight's lined up directly above your joints. And it's like, if you balanced something heavy on top of something, um, it's not pushing it left or right. So it doesn't take much muscle contraction to keep it because it's so lined up.
so you said initial contact because it's absorbing shock, or what?
Yeah. So it's weight acceptance would be
Okay.
the answer. So when the weight first hits and you're building that weight onto the leg, your body has to then absorb that shock.
Okay.
With a habitual posterior pelvic tilt, which of the following statements is true? So we just want to know which of these would cause or be present in someone that had a posterior tilt. And the other ones are all exactly wrong. So if the hip flexors were longer, that would cause an anterior tilt. If the um, hip extensors will be lengthened. Wait, hip flexors will be lengthened is the right answer. So you have to go back to this. If you're in posterior tilt, am I back to front? No, I'm not back to front. So posterior tilt, if the if this is the pelvis and this is your leg, you're actually tucking your pelvis this way, which lengthens the front of the hip. So the front of the hip gets lengthened, the back of the hip gets tighter. So the hip flexors would be lengthened. Um, what hip flexors would be short and hip flexors would be lengthened. Um, on a question like this, you can sort of game the question. If there's two things that are reverse of each other, it's probably one or the other. Because if the hip flexors were shortened, then the hip extensors are lengthened. Those are, so what she has in red and the second answer there that I'm highlighting, those actually go together. They're the same postural change. So they can't both be right. So they must be wrong. But it's definitely the hip flexors will be lengthened. Most of the knee flexion needed to clear the foot during swing phase comes from, and this is really a repeat of the question from before, that it's not your hamstrings bending your knee, it's the momentum of the leg swinging that causes the knee to flex. Spinal cord terminates at L2 below the subspinal nerves, continue as a bunch of nerves called the cauda equina. This is actually a lot more information than I should give you, but I was trying to make it easy to understand what I was going for. And that's just a straight definition straight out of your module. It is important to know that because when we're treating spines, there is no spinal cord below L2. Pelvic floor couple that combines to pull the pelvis into an anterior tilt are the hip flexors and trunk extensors. So that's again another question from that force couple from this page. So it's important to know those. This is just another definition. This area between the bones, it's actually the same. This is tibia fibula. It's the same on the radius and ulna, but it's called an interosseous membrane. It's important to know that because muscles attach to it and it divides and it holds the bones together. So that's just a straight definition. Nice job. Descending the stairs and leading with the right foot, the left quadriceps fastest muscles are performing what type of muscle contraction? So here, if you're standing on your leg and you're lowering yourself down to the next step, the knee is bending, so it has to be eccentric. So the quads are working, but they're letting the knee bend as they go. Does that make sense? Yes, no.
Can you explain it one more time? Sorry.
It's gonna. So if I'm on a step, oh gosh, it wants a face. If I'm on a step and I'm going down to the next step, my knee is bending as I go down. So my quadriceps are working, but the knee is bending as they work. So the quadriceps are actually getting longer.
Okay.
So that is eccentric as I'm lowering down the step. I don't know how else to explain it. Does that make sense at all?
Hmm.
Okay. And obviously, if you're on a step and you're pulling your body weight up, the knee is extending, the muscle's getting shorter, it would be concentric on the way up, eccentric on the way down. This muscle retreats from the anterior inferior iliac spine and inserts into the tibial tuberosity. So this is a harder question for you guys because I know a lot of you struggle with origin insertion. The only thing that inserts into the tibial tuberosity is the quadriceps. So it had to be one of the quads. And all of the quads start on the femur except the rectus femoris. So um, that's how I would figure that out if I didn't know the answer. Tibial tuberosity is all the quads, and the only one that goes up to the pelvis is rectus femoris. The angular force of the knee is increased by the presence of the patella. This increases the moment arm and allows for greater angular force. Which of the following best describes this scenario? We've talked about this in class. I don't know if it was on one of your assignments or not, but it's definitely torque. And I know we talked about it in class, and it's straight out of the um, module as well. So what the patella does is it takes the line of force of your quads and bumps it further away from the knee, and that further away gives it more the force arm is longer, which makes it stronger. And that's just how we define torque. These regrades were me attempting to fix something. They didn't actually make a difference. So these animation ones are leftovers from when Jeff had the course. I'm not sure I love them because the greens change. Considering this animation of hip flexion, how are the muscles working? So it is nice because it's showing hip flexion. It's not showing you lowering the leg back down. You're only lifting it. So if the muscle's getting shorter, it has to be concentric, which is exactly what you got. Some of these are hard because it says what phase of gait is pictured on the left leg. You have to realize which is the left leg. Sometimes it's hard to see through the pants. Just remember your hands will be opposite of your legs, and you can look for the arch in the foot if you can't decide which is left and right. So this is definitely the left leg forward. His heel is down, which might be initial contact, but he's already got his foot flat as well. So it's after initial contact and it's loading response. Definitely not mid stance because it's in front of him still. It's definitely not terminal stance because it's not behind him. And it's not initial contact because his foot is hitting the ground. Initial contact, just your heels touching. It's that point in time here before it rolls flat. How are we going for time? I'm going to speed up. You're asked, um, you're asked to instruct your client in eccentric strengthening of the hamstrings. So really, we just want to know which of one of these were the hamstrings getting shorter. I mean, sorry, getting longer as they contracted. Here, they're getting shorter. Here, they're actually getting longer as you lower yourself. Here, the hamstrings are getting shorter because his knee is bending. And here he's bending his knee. So, and actually he's not working against gravity here. So the correct answer is this. What is this called? There's a word for it. Something, Nordic curl. And this is a classic eccentric hamstring exercise. That one is a little hard because the pictures aren't great, but if you use the words as well, you should be able to figure it out. Yeah, so flexing the knee and standing is concentric. The open pack position of the hip. It's important to know the open pack positions, the hip, the knee, the ankle, and I would just review those. You got this one right. Sometimes you can figure it out on your own body. If you find the tight position of your joint, then it's going to be away from that position. For the tight position will be close back. The open position will be where it's not tight. The facet joints of the lumbar spine run in the sagittal plane. This allows what movement primarily? So, I mean, you didn't even really need this information, and you just need to know what way the lumbar spine moves, and it mainly does flexion and extension. That's just the way the spine works. And it's from the slides on the orientation of the facet joints. Lumbar spine does flexion extension. The trunk mainly does rotation, and then the neck does everything because of the angle of the facet joints. This question was all about insufficiency. So here he can't touch his toes because his hamstrings aren't long enough. And when you're not long enough, it's because it's passively insufficient. So that's the answer there. It had to be the passive one. I don't know what Maddie did to get that back to front. We've been over that so many times. What? Give me your reason for selecting active.
Um, it should have been passive. I don't know why I put that. Because I think
Everyone,
passive, you
every
can't passively move yourself more to make it
right,
shorter.
to make it happen. Yeah.
Yeah, so I don't know why I picked that.
I mean, he is actively moving, but his hamstrings are passive,
Yeah.
Yeah. Yeah, active, they'd have to be shortening, not lengthening. This muscle has an origin on the medial side of the entire femoral insertion in the tibial tuberosity via the patellar ligament. So again, tibial tuberosity has to be a quad. If it comes off the medial side of the femur, it has to be one of the medial quads. Sartorius is not a bad guess because it does go to the medial knee, but it actually doesn't insert on the femur at all. And it doesn't insert into the tibial tuberosity at all. It inserts into the pes anserine. Not a bad guess. This is the structure that lines the edge of, and deepens the acetabulum. That's just straight anatomy. The labrum is super important. So actually all these are important. The labrum, the ITB are important. These other two are just your straight hip ligaments, of which there's three. They're less important to know. What's this person going to do for us? He is sitting down. He's lowering himself to the chair. How are the muscles at the hip and ankle working? So again, if he's lowering, his quads are working while his knee is bending. So it has to be eccentric. That's the muscles are lengthening as he moves. So it has to be eccentric. This poor chap looks like he could have a scoliosis or a short right leg. So you just had to find one of these that might give you that. Is this the question you're saying the left and the rights were hard, Madeline?
No, it was like the fill, I don't know, match the definition to
Okay.
the ones, but this one I struggled with too, obviously.
So if his left quadratus lumborum sits here and it lifts your hip, so if it was tight on his left, that would account for this because it would shift him that side. If his right leg was longer, which is the second option. Oh wait, you said the left foot is pes planus. So if the left foot collapsed, it would make the left leg shorter, but he looks like his left leg's longer. So that can't be right. If the right leg was longer, it would push this hip up. So it can't be that either. And the patient has a head forward posture. That's not in the correct plane. We want something that's going to change his orientation in the frontal plane. And head forward is in the sagittal plane. When palpating the muscle bellies of the hamstrings, you need to know where they line up. This is how I remember the longer names with the more syllables are both medial. The one with more M's in it is more medial. So semimembranosus is the most medial. Semitendinosus is the second medial. And the one with the shortest name is the lateral one. That's just how I remember it. The spinal ligaments, again, this is just straight anatomy. There's an anterior longitudinal, a posterior longitudinal, ligamentum flavum, I believe, is on the top. You just need to know those, and look at that, you did know those. This one between is an interspinal ligament. That's the other possible answer. These were hard. We didn't cover these in lab. They are in the module. They're important aspects of gait that we didn't look at in lab. The difference between stride length and step length. Um, so a step is the distance between the placement of the two opposite feet. So one step, and a stride is when one foot lands till when the same foot lands. That's your stride. Vertical displacement should be the one that's easier to figure out, but it's the amount that your center of gravity goes up to down. So as we absorb shock, we lower, and then we come back up as we're in mid stance. So it's that vertical oscillation of our center of gravity. Accessory muscle restoration can be defined as muscles not normally used for breathing, but can be recruited. That's a straight definition out of your module. It also sort of makes sense. You got that one right, which is good. So this one, if you flex the knee, you find another person can move the knee even further. Yeah, so this one is, I mean, it's not, you could say that this person in the first picture, it's her quads aren't long enough, which would be passive insufficiency. But what the question actually asks is the active range is limited, although there is more passive range available. And that makes it active insufficiency of her hamstrings is what we're talking about. But I could see how this question is a little confusing. I'll have to fix that one for next year. But it is the reason she can't lift her foot anymore is active insufficiency. And again, we just expect you to know all these range of motions for terminal phase of gait. What are the range of motions for hip, knee, and ankle? This you could sort of guess a little bit because some of them were pretty far out of normal. Terminal stance, you got to have some hip extension, but not too much. Anyway, you might be able to game it, but really you just need to know those. So join that table of each phase, hip, knee, ankle range, and then primary muscle activity. So you'd have 4 columns for each phase, super important. Which is true regarding the role of the ankle and the foot joints. All listed are primary roles, the ankle and foot joints. This is straight out of your introduction to the ankle and foot module. And you got that one right. This is also straight out of the module, just the gait velocity is super important. It's an indicator of health. This muscle that sits way up high and inserts into the ITB is the tensor fasciolata. Oh, it is not. Oh, look, even I'm wrong. Tensor fasciolata comes off the ASIS, which is in front of the ITB. So this correct answer is glute medius. Sorry. My eyes are drying out. The hip is much more stable joint than the shoulder due to its bony structure and stronger ligaments. And that is true. The shoulder is much more unstable. Is it the most unstable joint? The most unstable major joint in the body for sure. The type of joint an intervertebral disc is cartilaginous. A lot of people get this wrong. There is a fibrous ring on the outside, but it is considered a cartilaginous joint. Again, straight out of your module. What motion occurs at the subtalar joint? This is sort of a repeat. It's not supination, pronation, because that's that combined movement of the entire foot. It's just inversion and eversion. If the hip medial rotators are performing medial rotation of the hip, how are they working? So if a muscle is doing what it's supposed to do, it's concentric. When you got that one right. Match the muscles to its action. So this this is basically the level of what we expect you to know from the muscles. Maddie did pretty good. She only got 2 back to front. And this is, like I said, we expect you to know the fibularis or the perineals, that they are everters. Tibialis anterior is a dorsiflexor. It's actually probably the only dorsiflexor of the ankle. But all these muscles in here, so your hamstrings, the ones we already talked about, the ankle, piriformis for sure, your glutes, your rectus, your quads, your hip flexors, you should know what they do, what direction they move the body. And Maddie did pretty well in that one. This is a question about the screw home mechanism. I do believe that's on the repeat final. So know about the screw home mechanism. Just remember the medial the medial condyle of the femur is bigger. So the medial side has to move further. And you should be able to figure it out after that. What phase of gait? Left limb. So this is his left. It's at the back. His heel's way off the floor, but his knee is still straight. So if you have that table built, you should be able to just remember knee at 5, ankle at, something near 0, but hip fully extended. And that's going to be pre-swing. What did you get? No, sorry. It's going to be terminal stance. Pre-swing, the knee is bent. The knee's already started to bend. So that's the difference between pre-swing and terminal stance. But you need that table. You need to understand the table. So this guy, what position is his pelvis in? He doesn't have a huge lordosis, but his butt's not tucked under either. So I'd say he's pretty much in neutral. And that's what Maddie says, and we agree. The big 4 ligaments of the ankle, everyone should know. So that's what I was going for here. Maddie got at least 1 wrong. So she got the posterior and the anterior back to front. It's where they insert, make sure I say this right. D, well, D should be anterior. Did I do that? Yeah, anterior cruciate. So D is anterior. It's where they insert on the tibia. So the anterior cruciate inserts anteriorly on the tibia. And you can see in the picture one's in front of the other. And then the medial and lateral collaterals are pretty easy. There's a ton of other little ligaments in the knee that I'm not expecting you to know, but those 4 you should have pretty squared away in your head. There seems to always be a question on the pes anserine. There's 3 muscles there, and Maddie must have studied those because she got them all right. Great job. I will tell you, it is sort of weird for me that semimembranosus is more medial on the body, but it stops short, and then semitendinosus keeps going to reach the pes anserine. So it's a little, in my mind, a little hard to figure that out. The main muscle attached to the ITB is the TFL. All the following are 2 joint muscles except. So this one I would hope you would know, that soleus is a 1 joint muscle. We talk about it so much when we talk about how to test plantar flexion strength and differentiate between the 2. The first 2 vertebrae of the spine have unique structure. Oh, you got this one right. You were saying you got it wrong.
I thought I
Madeline.
put access. Never mind.
Yeah, the top is the atlas. The second one's the axis. That's all I need to know. What's this person doing? This is hip flexion again. Which of the following muscles are working to flex the hip? So this, I didn't actually, I know I did. So they're all on there. You just need to know what muscles flex the hip. And I didn't say, sometimes I'll say, mark the three, or, which three muscles flex the hip as an added degree. But these were pretty straightforward. The vastus muscles, the quads that are called vastus, they don't cross the hip, so they have no effect on the hip. But psoas and iliacus are your normal hip flexors, and rectus femoris is the quad that goes over the hip joint. Pitching planes of pain in the posterior thigh from their pelvis to their knee. So this is saying that there's an injury to the nerve in the area. Which of the following nerves lives there? And that's obviously sciatica. So the back of your leg is the sciatic nerve. Femoral nerve is on the front of the leg. Obturator nerve is on the medial part of your leg. And the tibial nerve is in your lower leg. Actually, the sciatic nerve, when it hits your knee, it splits in two. And one is the tibial nerve and one is the common peroneal nerve. But that should be a very easy nerve question. Having a client bend at the hips and knees to do sit-ups. So this question, when we do that, why do we do it? It's so you can't use your hip muscles to do your sit-ups. And it's because it makes them actively insufficient. So it makes your strong hip flexors actively insufficient because you're shortening them, if that makes sense. And they're not passively insufficient because your hip flexors are helping you do a sit-up. So it can't be passively. What is the name highlight of the muscle highlighted in green? So we got a lower leg. There's our tibia. It's on the lateral aspects of our tibia. And then it goes to the medial foot. It's got to be tibialis anterior. You got that one right. And again, it's one of the few ones I expect you to know at the lower extremity or the lower leg. Muscle activity of the ankle during mid stance. We covered this in lab a lot, but it's your plantar flexors that are controlling the forward progression. So it's eccentric control of closed chain tibial movement. So that's a great answer. That's a hard question, but you did great. The most commonly sprained ligament of the ankle is the lateral ligaments and the anterior one. So when an ankle sprain occurs, the tears happen laterally to the front, then to the middle, and then to the back. So the anterior one's first. The calcaneo tears second. The posterior one would tear third. And then the medial ones, which are the tibial ligaments, rarely, if ever, tear. The diaphragm is supplied by the phrenic nerve. That's important to know. You got this question right. If you have a fracture, like a neck fracture above C5, your diaphragm can't work, and so you die because you can't breathe. So that C5 is what's important there. The head and neck are what type of lever? So all of your axial spine is going to be first-class levers, and then all of your appendicular or all your arm and legs will be third class. This is some really hyper recurvatum of the knees. You got that right. Lumbar sacral angle is the angle between the superior surface of the sacrum and the inferior surface of L5. The optimal angle is 30 degrees. This is straight out of the textbook. It's just when you're standing, your pelvis, your top of your sacrum on your pelvis tilts your spine forward a little bit. And that's so if we have that, then your lumbar spine has to come out and have that lordosis. That has to have that back bend to get back vertical. So that's where the lordosis comes from. Then it's just a question of, well, how much tilt is it? And you got the correct answer, it's 30. But it can't be 0. 45 is too much. So it had to be one of the other two. Which exercise creates the most patellofemoral compression at 10 degrees versus 90 degrees? So at 90 degrees, the difference is gravity. Here at 90 degrees, the weight is right below the foot. So it's not very heavy because the moment arm of the weight when the knee's at 90 is minimal. Here, the weight is way behind the knee when she's at 90. So the knee's working much harder at 90 degrees here. So the squat is going to be the right answer because the knee is working harder at 90. And then obviously in this seated position, the quad's working harder when the knee is straighter. That's going to be super important next year when you do Therex, like, how to get the right amount of force at the right time in the cycle of movement. What's this person doing going backwards down a stair? What motion is occurring in the knee and the stance leg? The stance leg is flexing as they go down. That was a really easy question. The main muscle that keeps the pelvis level in the frontal plane during single leg stance is, oh, you said adductors. It's the abductors of the stance leg. So when you're standing, if this is your leg, this is your pelvis. If you lift your other leg, your pelvis would drop. So you have to hold your pelvis up. And the muscle that pulls up on the pelvis is the same that would pull out on the leg. So it's the abductors pulling the pelvis up. This muscle has a horizontal pull, making it important muscle for lumbar stability, where it works in conjunction with the diaphragm, pelvic floor, transverse abdominis. Yeah, so horizontal and transverse are sort of the same. So that was the clue to that one. Also, the transverse abdominis is the muscle that doesn't move the spine. It compresses the spine, and it's the one that's important for stability of the spine. So this matching, you said this one was hard, Maddie, right?
Yeah, that one was hard for me.
So we do expect you to know the different abdominal muscles. Rectus abdominis is your six pack, so it really just does flexion because it's so in line, like in the middle. Transverse abdominis does that compression of the spine. We expect you to know that. The obliques, one oblique does one rotation and one does the other. So they do lateral flexion and contralateral rotation, lateral flexion and ipsilateral. So they had to be matched up because one goes one way, one does the other. Quadratus lumborum does side bending of the spine because it sits, if here's the spine, it sits off to the side. It runs from the ilium to the ribs. So when it contracts, it does the side bending. And then we didn't get into the different erector spinae just as a group. They are trunk extensors. And suboccipitals are at the base of your neck on the back, so they do head extension. So you did fine with that question. It was a harder question. Okay, so we have a patient with a 3 minus out of 5 on a soleus based muscle test. What phase of gait would be most affected by this weakness? So really it's saying, when is the soleus most active during the gait cycle? So again, you need that graph or that table showing what muscles work when. And your plantar flexors work mainly during mid stance and terminal stance. Remember that the ankle movement that occurs during swing is passive, it's momentum. Initial swing and mid swing, you're actually lifting your foot into dorsiflexion so it doesn't drag on the ground. So that would be the opposite of soleus. That would be tibialis anterior. The biceps femoris is a good example of, and a good rule of thumb, if it's in the periphery, it has to be a third class lever. So all of your hamstrings, all of your quads, all of your ankle, almost all of your ankle are third class levers. This is the last question. Yeah. So this person is the same guy walking downhill backwards. What movement is working at the knee during stance? So there's 3 questions on stairs and quadriceps, but the quadriceps As you're going down, the knee is bending. So the quadriceps are getting longer. So it has to be eccentric. Oh, and which of the muscles? So yeah, it's the one that's the quad muscle. So that one's a quad. None of the other ones are. Okay, that's it for reviewing the last quiz. Are there any questions before we move on? I know it's a lot to go over super quickly, but I hope it helped and gave you some ideas of what you know and what you don't know. Madeline, you're not muted. What do you think?
Um, I just need to really look over gait. I think that's where I struggle with a lot, and that's I didn't study a lot of it, so it makes sense. I just need to learn the range of motions and then the muscles, the activation parts, because I didn't really look over that so much. So I will do that this time. Is there a lot of gait in this next one?
I think there is. We'll go over it and I'll let you know
Okay.
exactly. Kaylin, what do you think?
Definitely need to go over gate too, but I kind of just struggled on a lot. So I'm just gonna go over everything.
Yeah.
Do you think it's gonna be beneficial to just do like midterm on, nothing in the beginning? Really?
Well, but the passive and active insufficiency,
Yeah,
the
for sure for
questions
me.
on torque, the questions on levers, like, that stuff you still need to know.
Yeah.
But yeah, let's look at it and let's see. Daisy, do you have anything you want to say or
Nope, I'm good.
um so I'm gonna stop sharing and then I'm gonna go back. You can't see my page, correct?
No.
Okay. That would be a faux pas if I gave you all the answers. I think I already had it up. Is it there? Final exam retake. Okay. So I believe it's 66 questions. It's shorter. It is slow to load. Oh, am I wrong internet? 66 questions. And it's the same. You're gonna get random order and random order of questions and random order of A, B's, and C's, multiple choice. Um, so the first questions are all about the spine. Um, they're really quite general. Um, what can I tell you that's not too specific, but that's going to help you? You need to know the curves of the spine, which you should. That should be easy. You need to know the size of the vertebrae. You need to know what positions increase pressure in your disc, which not everyone does, but there is a page specifically on that. You need to know your ligaments of the spine, like was on the last exam. You need to know those atlas, axis, like all the special bones of the spine, the sacrum.
Are you saying ligaments like the anterior and posterior ones that you had a picture with? Are you talking about those?
Right,
Okay.
right. There was 4 on there, so that same picture's on there.
Okay.
Um, you get that one wrong, I want you to fail anyway. What's the primary muscle of respiration? There's a question specifically. We had that head forward posture um, lab. There's a question about that. Here, yeah, here is the second question. Remember I said there was a question on the Sarman movement system? There is. Um, am I going to tell you any more than that? I don't think so. But review the Sarman movement system.
Is that on your modules?
Yes.
It is, okay.
I think that might be the only place it is. And I will tell you that's not from me, it's from the person before me. But Sarman is really well known. She actually just lectured in California or I guess last year. So she's still, alive and researching, um, but it's good knowledge.
Is that in
It's in lumbar
that's
spine.
in lumbar spine? Thank you.
Remember I said you need to know the muscles that create pelvic tilts. There's at least two of those questions. So make sure you know that picture I showed you earlier. That's a super hard question. The accessory muscles of respiration. Um, the muscles, um, the group of muscles for lumbar stability. The bones of the pelvis. Um, I can't really give you a clue on that one without giving it away, so I'm not going to. There's a question about nutation and counter nutation, which we reviewed in the quiz that we just did, but I would review those. And that's just the movement of the sacrum. So review that. Uh, the joints of the pelvis. What should I say? The types of joints of the pelvis. So how is the sacroiliac joint different from the pubic symphysis? Here's a question on pelvic tilts. The same question Maddie got wrong about which muscles are working to control pelvic tilt. No, which muscles are working in the stance leg during gait, during single leg stance? That same question is there. It's written differently. Um, Normal range of motion of a joint. Oh, clicker, I'm losing power. There is closed pack position of lower extremity. Okay, so there's a matching muscle one. What can I tell you? One, there's a muscle misspelled in it. I would say you need to know, this is actually hard. So you need to know the movements for sartorius, TFL. I'm just going to tell you all of them. Gracilis, rectus femoris, semitendinosus, and piriformis. Give me one sec. Hey,
What was the
girls.
last one? Piriformis?
Piriformis.
Yeah.
Oh, the other girls are making dinner for everyone. Is it okay? Yeah. Okay. Okay, sorry. I now have 6 kids in the house. Um, you know that one. There's a question about the hamstrings that we just reviewed. There's a question about the screw home mechanism that we just reviewed. There's a very similar patella question, like what does the patella do for your strength? The answer is not torque this time, though. Ah, so I clicked and it wanted me to edit. Go back. There's really the same question about what causes um, your knees to be varus or valgus. There's the same question about, not the same question, but you need to know your knee ligaments, the same 4 that we just talked about. Does anyone remember the anterior cruciate? Where is it anterior?
To the tibia.
On the tibia. Good. Remember that. There's a question about the muscles of the pes anserine. That one you're going to know without anything. That one you're going to know without anything. That one you should know. That one you should know. You need to know the concave convex rule for the ankle. The difference between inversion, eversion, and supination, pronation, you still need to know. The ankle ligaments that tear, you need to know still. The bones of the midfoot, you need to know. You need to know where they are.
You said of the midfoot.
Of the midfoot,
Okay.
which is really the whole foot, because the hind foot's the talus and calcaneus, the
Yeah.
front of the foot is the metatarsals. So you need to know all those little ones in the middle.
Like where the transverse arches. Is that what you're saying?
No, because that's really the metatarsals.
Okay.
Like the cuboids, the navicular, the what's the other one? The cuneiforms, all those guys.
Okay.
There's a question about the arches of the foot again. I told you the muscles you need to know about the ankle. So your gastrococcaleus, tibialis anterior, tibialis posterior, and your fibularis muscles. So definitely know what each one of those does. I don't know if you guys went over this. I don't know if we went over this much either. Um, but it's a famous Marcy saying. Do I need to tell you? So in the gait cycle, um, no, I'm not going to tell you. Like, because I can't tell you without just giving you the answer. These are all gate questions.
Is the saying that you're talking about in your gate phase of like the videos that you provided? Do you think?
Yeah. Do you want me to? Yes, I know it's on my pages.
Okay.
Okay, so remember I said do that graph? Definitely do that graph because I'm in gate right now.
Oh.
So there's, our muscles working eccentric or concentrically. Um, what's the definition of a phase of gait? And I give you the definition, you have to give me the phase. What's the critical event occurring during a phase of gate, and all of those are straight out of the module. So I think if anything, you should all definitely review gate. A maximum range of motion for a joint during gate. So you need to know all those range of motions. That same question about why a knee bends during swing is on there. If you remember what we talked about, it's not your hamstrings creating the bend in the knee, it's momentum. I think that one's fine. Yeah, and again, another muscle activity during gait. Oh, this one's oddly specific, and you're going to get it wrong. The minimum speed for community ambulation, and I'm just going to tell you, it's 0.8 meters per second, which is, I'm sure it's exactly out of your module because all these questions are written that way, but we never really reviewed that, and it's a really random fact to put on an exam.
And you said for community.
Yeah,
Yeah.
is 0.8. Weakness in the another muscle activity during gaits. Another question on pelvic tilt. Um, and there's two of them really. So when the pelvis tilts one way, what happens at the hip and what happens at the lumbar spine, right? So if we have posterior tilt, you're getting hip extension, lumbar flexion. If we get anterior tilt, you're getting hip flexion, lumbar extension. So you got to be able to visualize that in your head. There's a question about when the pelvis is level, and this is from your posture. So we're into posture now. Um, and actually, I probably will give you this one. Your posture paperwork said that the pelvis is level when the ASIS and the PSIS are level. And that's what your paperwork said, and that's what the answer to this question is. I think, and the reason I'm giving you the answer is during lab, we really thought that the ASIS is actually a little lower. But as per your module, the pelvis is level when the ASIS and PS and IS are level. You need to know what falls in front, behind, and through the plumb line. There's only one question on it, but there is a question on it. There is a muscle highlighted in green. Should be really easy. There's two of them. What would I say? I would say no, they're quads and hamstrings. There you go. That was nice of me. There's a third one that we've reviewed today already. There's a concentric eccentric question. There's another concentric eccentric. And that's it. That's 36 questions. Where are you guys? Okay. So that should give you a lot to go off of. It is, I think, an easier, more straightforward exam. I wrote it myself, so there's no old questions from Jeff or Mendocino. I like the question I had on gate speed. There are supposed to be some in there that are hard, that because we don't want everyone to score 100%, or we don't want everyone to score the same. We want to be able to show that the smarter people know more, and the people that are struggling. So that's why it's not just a dead easy exam, but I think it should be well passable, especially if you know your gait cycle. it seemed like the posture stuff was less, it's more intensive on gait, lumbar spine, pelvic tilts, and hip and knee. Those would be the areas. I can't think of anything else to say. Any, what do you guys have any questions or have any anything you want to tell me or
I don't have anything now.
okay. I I'm assuming this was beneficial. Yes.
Yeah, very.
Yeah.
Okay. I am going to record it. So if you probably won't want to watch it because you don't have a whole lot of time left. So hopefully you took notes. But if you didn't, or if you want to, I'll post it. Um, where will I post it? Maybe I'll email you guys a link or something.
Okay.
All right. Feel free to reach out. I'm available for Zoom if you guys have any questions. I think I gave you all my phone number. You can call or text me. Just don't abuse the privilege. But if you need me, please reach out. I want you guys to do well. Okay.
Okay, sounds good.
All
Thank
right. I'll
you.
see.
Thank
Yeah.
you.
Sure. I'll see you all Wednesday.
Okay, thank you.
All right. Bye.